NHFT offers a range of different services. So we're not just a mental health trust, we're a mental health and community trust, which means that we've got mental health services for children, adults, and older people. And we also have community beds, we've got district nursing, we've got dental services as well. So we've got medical careers for psychiatrists, we've got medical careers for physicians, we've got medical careers for GPs, we've got medical careers for palliative care physicians as well. So we're offering a range of different medical and dental careers at the Trust, and that's what makes us really unique. The Medical Directorate contains a number of different departments. We've got professional standards, we've got pharmacy, we've got research and innovation, and then we've got the operational clinical directorships. We've got 3 DMDs, 2 for the 2 operational directorates, 1 for the mental health services, 1 for the ACA Directorate, which stands for the Adults, Children and Ambulatory Services. And we've also got a DMD for Professional Standards. We are an outstanding trust, and with that comes really, really strong values. We're all about the people that work for us, so we do all our best to make sure that they are well looked after. They've got job plans that are fit for purpose, that are doable, that they enjoy coming to work, because we know that people are more productive when they're happy, so we focus a lot on that.
NHFT is a really great place to work. Our trust values, like any organisation, guide what we do every single day, but what's nice at NHFT is that you can see that there's a real buy-in to those values. You can walk around one of our sites and you see colleagues put those values into action every single day. Whoever you are and whatever your role is, we all understand why we're here and what our aims and ambitions are.
What do I love about the Trust? It's the people, and it starts from the top. So we have a chief executive and a medical director that has been very flexible, very open, they encourage innovation, and they've worked really hard to make transparency important in this trust. And that trickles down from the top to the bottom, and it really changes the whole culture of the trust. So I think in this trust, we don't really get bogged down by problems. The question we ask is, how can we make this happen? And we make it happen. So I think if you want to work at a place where you can make the service and the job your own, if that's what you want, this is the place to be.
We split our services mainly into 2, those dealing with mental health per se as a whole, and those dealing with dementia. So we have memory assessment service that is responsible for anyone who have cognitive or memory issues. We do memory assessment, referrals mainly from GPs or anyone who is concerned about their cognition in terms of having functional difficulties from their memory. The memory assessment services are based in all the localities, so you don't have to travel long distances to have access to them. And those people with long-standing mental health conditions who's grown up with them or having mental illnesses presenting for the first time in their life in old age will be accessed as well at those teams. Unfortunately, the majority of dementias haven't got a cure. And at the moment, their drive is for us to find solutions and to help find answers to at least find something that will stop the illness or reverse it. We have multiple levels of support, so it depends on what level the individual is. All junior trainees will have support from what we call clinical tutors or educational supervisors, and we support junior doctors. We have junior doctor forums. Senior doctors will have mentorship, which we encourage every new doctor to have access to a mentor who then support and maintain them in terms of building up their confidence, coaching them in terms of our local variations in terms of service provisions and so on. And that is offered to every doctor that is recruited into the trust.
At the center of everything that we do as an organization is the patient and the population that we serve. So it's really about giving high quality care. And one of the ways that the Medical Directorate contributes to that, apart from just offering the clinical services is that the Medical Directorate leads on innovation, which is one of the key strategic objectives of the Trust. So we've got the Research and Innovation Department within the Medical Directorate, in which we are looking to recruit an associate professor who becomes more of the medical lead for research. We'll also have a head of research and innovation and a director of research and innovation as well. So we are really looking to sort of invest in careers in research and innovation. We want to build centers of excellence in that space, and we really want to drive up that quality improvement.
We've developed quite an extensive portfolio of innovation and research. We were also the leaders in body-worn cameras for nursing staff and staff on the wards. We got quite a bit of coverage from that and published some data on that. And we were the first to actually publish data on body-worn cameras in mental health. The other areas of innovation are particularly in TMS, intravenous ketamine infusions for depression. We've done some work around vagus nerve stimulation for depression as well. We also have done some work with our GP colleagues. So we have a depression pathway in Northamptonshire, which tells GPs what antidepressants to use, first line, and then a treatment-resistant pathway, which is unique in the country. We were the first NHS organisation in the country to offer TMS to NHS patients. I'm fascinated with TMS and treating patients with TMS. It's absolutely so rewarding to see people who literally have been ill with depression and just sitting at home doing nothing for 10, 12, 20 years, now suddenly going back to the person they were before the depression started. That is absolutely amazing, and the staff love it.
I'm the lead clinician for the Perinatal service in Northamptonshire. We do offer psychiatric care for women who are pregnant and in the first 24 months of the postpartum period. It is actually quite an exciting field. It's a new service that has been developed in the last few years, particularly within Northampton. And we have expanded from a team of 4 to over a team of 55 now. So what we are able to offer is that faster access to moms, in particular the higher risk period, which is that immediate postpartum period. We also have quite a range of interventions that are available, not just medical assessments, but also psychology, nurse-to-nurse intervention, and more specific psychological therapies like video interaction guidance. For new doctors and allied health professionals who want to work in our area, there are fantastic opportunities to be able to not only learn but also take part in research.
I have the privilege of working within the Specialist Palliative Care Service across Northamptonshire, whereby we look after and support adults with life-limiting conditions, and we work across the acute hospitals. We have our inpatient beds within our hospices, which we've got 2 in the county, and we support people in their own homes. And we very much support people from a holistic point of view, so we manage their symptoms, we support them psychologically, any social issues, and spiritually as well. Although we obviously have our patients, it's very important that we actively involve families and carers and everything else. And we'll go on to help them through their bereavement as well, and also actively support children. We have other services that we can access to help support child bereavement. We're very much a multidisciplinary service, so again I have the privilege of working with fantastic nurses, physiotherapists, occupational therapists, chaplaincy team, psychologists. We're supported by a psychiatrist as well. We have an amazing volunteer group that help deliver our service too. So I think we just aim to give them a thorough understanding of how the service works. As a trust, I think it actively encourages diversity and inclusivity, and I think it helps to promote particular groups as well. So there's quite a strong active role in sort of women in leadership and things like that.
We have a comprehensive CAM service in Northamptonshire. It's responsible for the mental health of all children below the age of 18. As expected, most of our referrals are between the ages of 13 and 18. We have both a community service and an inpatient service. We have a crisis team and an intensive outreach team. So we are able to provide support for children at all stages of distress. Northamptonshire is the lead provider for the children's inpatient service, and I'm the clinical lead for this. So we are responsible for commissioning all the beds in our region and essentially looking after the inpatient needs of all psychiatric children. In Northamptonshire, we've taken an initiative which has proved successful and which we are now rolling out all over our region, which we call Grow Your Own, which is in a sense creating senior consultant roles and helping people in junior roles to move up. We are very team oriented. It's very important that we support each other and the well-being of the members of the team, because we totally believe, and it's a ingrained tenet into everybody, that if we don't take care of the team, we can't take care of our patients. Since taking care of patients is our primary objective, if we don't take care of the team, we can't achieve that. So there's a lot of support at all levels for the team. And in the children's services, I can say that, we believe in families. So, if we don't support our families, how will we ingrain the culture of supporting other families? So really that kind of direct line from the senior management to the staff, their families, and then that trickling down to the patient, that is not a trickle, it's a straight highway.
The journey has been good so far. Having the opportunity to rotate through the different subspecialties, moving you from your comfort zone. Generally, I would rate the support as very good. The trust had really shown so much support. For instance, when we first arrived, they had a taxi waiting for us. That really blew my mind, because I know from other trusts, nothing like that happened. You had to find your way. I had colleagues also working in UK, and they told me that was actually exceptional. They provided accommodation. We weren't left alone to do all of that, because it would have been difficult. You have no credit score, you had no bank details, so it would have been a difficult process. But the trust actually took that upon themselves. I think they provided us with accommodation for 2 months, and the current accommodation where I am staying, the trust actually searched for it and then got the place for me. So the support has really been so good. What stands out about this trust is that level of support they give to you. It's individualized. It's not about one shoe size fits all. People actually look out for you and actually want to know if you're doing fine, if things are going well with you. And I think that's actually is something positive. Take the step. It's a good thing. It might be rough in the initial process, just as it would happen with anybody transiting from one place to the other. I still think I will actually recommend them to come with the trust. In terms of the patient, I would say I feel important, because back home in Nigeria, even though you're doing something, I've never felt this way before. There are lots of things that you feel that you're able to offer the patient, and you are clearly making a difference with the patient, because you have a lot of support, and you have the training, you have the equipment, you have the things that actually make you that actually prepare you to create that difference in your patient.
It doesn't matter who you are in the organisation, we are all ultimately having an impact on our patient's journey. The better we can fulfil our roles and support our clinical colleagues who are delivering frontline care, the better that patient journey is going to be.
One of the reasons why I love working for NHFT is because of its values. For me as a clinician, I always strive to do the best for my patients. And when you work in an organisation where there is that culture, it makes it very, very easy for you to achieve that. So it's not just about, a career as a medical director. It's about a career as a medical director who makes a difference. That's what I was looking for when I came to NHFT, and I think I've got the best of both worlds, I think. Northamptonshire is quite accessible to central London, but it's also got that really nice countryside feel to it. There are lots of outdoor activities. I do spend quite a lot of time at the weekends in Northamptonshire, so I quite enjoy just going to different places.
Northamptonshire is a hidden gem, I think. It's really well positioned, which is a massive selling point. When you look at a map of the UK, we've got great transport links to all those big population centres and places that we might traditionally think of going to. So it's really easy to get to London, it's really easy to get to Birmingham, Leicester, Liverpool, Manchester. We're in an ideal place. So that's a massive benefit. If you're coming from abroad and you've got friends, family that are already here, you'll be nice and centrally located.
I think the fact it's a slightly different county in the sense we've actually got 2 acute hospitals. There's an array of different services that all have an interface with each other, so you've always got a colleague that you can call to help and support with anything that might be slightly outside your area of specialty.
I personally found that Northampton is the right place to be. I actually started training in Northampton as a junior doctor. I felt well supported. I felt the environment was right for me, and I've been here after specializing as a consultant back to Northamptonshire. So it's the right place to be. There's good educational networks in terms of schools, provisions.
Well, I think the lovely thing about Northamptonshire is the county itself and the rural areas. Now, my original CMH team back in the day was in Daventry, and the countryside out to the west of Northamptonshire is really, really beautiful. There's lots of quirky stuff. I lived in a village for a while. I'd never lived in an English village before. It was quite fascinating to, hear the horses' hooves clip-clopping down Main Street on a Saturday afternoon or Sunday morning.
I've lived in Northampton for 10 years, and I can say that there are a number of activities that I have been able to pursue. I've always been interested in sports, so there have been local number of clubs. I actually used to run the local table tennis and badminton club for about 8 years, and then took up cycling. And again, there are so many opportunities. And I can talk from a family point of view that having children, they have had the opportunity to get into kind of drama through the kind of well-renowned Derngate Theatre, and as well as rowing opportunities. And I feel that these opportunities are quite accessible as well, not just being available.
It's a delightful mixture of urban and rural. So you can live in a well-served place where you have supermarkets in 4-5 minutes, and in 5 minutes you're walking among fields, So that kind of availability for, I would say, almost 80% of the people is, I think, unique to Northamptonshire. It's a beautiful county. As people will be aware, it's called the Rose of the Counties. And so it's a wonderful place to live. It offers you this mixture of having all the facilities without having to travel very far, but still being urban. I don't think you get that combination in most places. It is either urban or rural.
I've joined the gym already, and I'm really enjoying myself. I think long walks. I like swimming, and I'm hoping to go maybe climbing or something like that. But generally, I've been involved in in some activities in Northampton.
I think there's a lot here that people don't realise, and probably we've suffered from a little bit of injustice over the years of, Northampton's just somewhere you go through on the way to London. It really isn't. And I think, as a place to live as well, house prices are reasonable. Much better than they are in somewhere like London or Birmingham.
If you're looking for a place where you can raise children, if you're looking for a place where you can, have a really active nightlife and still have, time for your family, Northamptonshire is definitely the place for you.
It's a perfect place to be, I think.
It's a nice county to work in.
I think it's a good place to work, to live. So welcome to NHFT.